To have you here. We're really excited to talk to you about our weight loss options at YBA. And so for most of you already know me, I'm Jen Collins. I'm nurse practitioner and owner of Your Beautiful Aesthetics, which was established in 2017. And prior, I was a nurse, and then I worked in primary care and hormone therapy. And then we've been doing all things aesthetic, hormone based, and weight loss here at YBA. And then Christina, introduce yourself.
Hi, everybody. For those of you that don't know me, my name is Christina Johansson. I have actually been with Jen now for about a year, had my
Yeah.
year anniversary on the 15th. I too was a nurse. We actually worked at the same hospital together at Mayo Clinic Hospital, was there for 6.5 years, been a nurse practitioner for about 9. And again, like Jen, background with primary care, hormone therapy, thyroid management, weight loss management. And when I added up, Jen, our years collectively, we've been working in medicine for like 38 years combined. So a lot of knowledge going on here.
Oh my goodness.
All right. So to kick it off, we wanted to highlight some potential causes that lead to obesity or being overweight, some of which are in our control and some of which are out of our control. And we all know that obesity is an epidemic, and there is just a lot more recent light on it and on the impact that it has and on this kind of weight loss journey, and everybody's really interested in it. So one of the things that can contribute to obesity is aging. So age is not on our side. We know that as we age, our body metabolism slows down. We then have a decrease in muscle mass, which then further slows down our metabolism. Genetics, unfortunately, not on our side. We can't really do a whole lot when it comes to our genes. Obesity can run in a family, and there are certain genetic variations that affect how our body processes food. There actually is a rare genetic mutation on the MC4R. I found this interesting. And it's a genetic mutation that leads to uncontrollable hunger and excessive weight gain. Like those people legitimately, because of their gene mutation, cannot control their hunger. Medications like antidepressants, anti-seizure meds, even beta blockers that control our heart rate. There's some allergy medicines actually that can all, steroids like prednisone, all of those can contribute to increased hunger, increased appetite, and therefore weight gain. Cultural and environmental. So it's interesting because there actually are some cultures that believe that a larger body size is more associated with beauty, affluence, prosperity, success. And then there are the flip side where, being overweight may actually be not a good sign either. You're not healthy or you're unhealthy or you're assumed to be sedentary. And family traditions, there might be certain preferences, comfort foods, and certainly Western culture in and of itself. I think the US is the only one out there that has like supersized meals. So we're just an unhealthy, population as a whole. And then certainly, there's other environmental factors that can contribute to it, like social media issues, even means to have access to healthy food options. So if you work at a place and you don't really, all that is around you is fast food, you don't really have a choice but to go choose unhealthy options. And psychological factors, if there's anxiety and depression underlying, that can lead to stress or emotional eating, binge eating, because we're trying to use those as coping mechanisms. And all of that can lead to being overweight and obesity.
All right. And then with obesity comes other medical conditions like heart disease, high cholesterol. We can be more at risk for heart attack and stroke. Also more at risk for certain types of cancer, liver disease, sleep apnea, type 2 diabetes, and then not to mention just like the extra weight on our joints causing back pain and decreased mobility or risk for injury. Also, asthma can be a complication. And then just anxiety and depression. I mean, with obesity comes, self-image issues and maybe someone secluding themselves or being depressed or anxious about it. And we see all walks of people. We may have someone who does have a higher BMI that is more at risk for health conditions. And then we also see a lot of our patients are very healthy and very health conscious. They work out a lot, they eat healthy, and they just may have like a little bit of annoying like abdominal abdominal fat that they want to lose. And we're here for them too, because we're not going to tell them like, you don't need weight loss.
It's
Because
all
like we
relative.
all know that, yeah, that if that's important to you, then it's important to us. And your confidence and your self-image and how you feel about yourself is absolutely what what we're all about here at Your Beautiful Aesthetics, and we want to help you do it safely and effectively.
I know I love this image though, because I just feel like it really shows that it's not just one thing that's impacted by obesity, but there's like so many different.
It's not just image, it's like
Yeah,
internal.
a lot of internal
Not to
destruction,
mention feeling more tired and
inflammation, and like there's
yes.
just so much that goes into it. So the one of the main things that we want to make sure that we do when we're talking about weight loss and you're going to start your weight loss journey is to identify the root cause. Is there something else underlying going on that is an imbalance of some sort that we need to address? Because the point is, like, if you're trying to lose weight and we're not addressing that root cause and fixing the underlying issue, no matter what you do with your weight loss efforts, you're exercising, eating right, you could turn blue in the face. But if we're not treating the root cause, all of those efforts will be blunted. You may even, once you stop those medications, rebound because the underlying issue wasn't fully addressed and treated appropriately. So we will recommend doing an advanced workup with labs to look for an imbalance in sex hormones, in particular with testosterone and estrogen. So when we have a decrease in our testosterone levels, that contributes to changes to fat distribution. Same with estrogen. When our estrogen levels decline, that actually can lead to mid-central or abdominal fat accumulation. So we want to correct those hormone imbalances. Testosterone can help pull sugar into the muscles so that when you're working out, you get more benefit, more muscle gain, more muscle strength. And with estrogen, we're just balancing out that distribution of fat in general. And estrogen also can, when you have decreased levels of it, it also increase your appetite and your cravings too. So sugar cravings, that's one of the things that we see a lot with our hormone women. It's like, oh my God, I'm craving all this sugar. And it may be, an estrogen testosterone imbalance. Some other imbalances that could contribute to obesity or being overweight or underactive thyroid, like hypothyroid, where your metabolism, your body's engines just slowed down. And you might not be necessarily in that, reference range out of normal, but you might be suboptimal. We still need, an optimal thyroid for optimal health when it comes to our efforts with weight loss. So we want to identify that. And then certainly adrenal issues. So PCOS is an issue because there's insulin insensitivity. And so we want to identify that so we can kind of make sure we're managing it on the medical side. And even Cushing syndrome, that's where you have too much cortisol leading to fat accumulation and an imbalance in your stress hormones too. So a lot of different things that we need to make sure we identify in order to set you up for success in your weight loss efforts.
So here at YBA, we're all about a comprehensive approach. As a existing patient, we have a lot of info on you already, and we can easily tie you into one of our programs. For a new patient, we're going to be doing a thorough physical and personal history of your medical history, also family history, looking at blood work, saliva, urine, doing a physical exam as well, getting vital signs. We also do see patients remotely, we still would want blood work on those patients. And, we would love to see you more in person. If we're seeing you remotely, we're usually checking to make sure that you are seeing another doctor, you've had a primary, that you've had a recent blood pressure. So we're trying to look at all of the, we don't want to skip any steps in our process. And we're ruling out, thyroid disorder, diabetes, hormone imbalances, vitamin deficiencies. And really, it's just, we're trying to make sure that we are setting you up for success. And we're going to just customize the treatment to you. Some people are unable to have certain medications. Some people, they are sedentary due to an injury. So we're going to look at each person and try to find out the best option for you, whether it be some diet coaching, or if we need to introduce some medication or use some of our weight loss devices.
Yeah, very integrated. We do all of it. So wanted to just touch base on all the different treatment modalities that are available. The ones that we, focus on here at YBA would be lifestyle modifications, weight loss supplements, prescribed weight loss medications, and then certainly if push comes to shove, we can certainly be an advocate if things aren't going well. You can, there's endoscopic procedures that are an option, surgical interventions and counseling, and all those would be certainly outside of our scope, but we would, if we needed to give you a referral or you work with your primary care provider, to pursue those kind of next level interventions if needed.
And a lot of the time too, I just want to add,
Yeah.
like we do see sometimes when men and women do have some issues with weight, we'll start a lot of the times with balancing their hormones, and sometimes it's not even an issue anymore. We can see them like reach their goals without even going further with weight loss modalities.
Yeah. Our goal is to prevent all that, right? To not even have to get there.
All right. So lifestyle modifications are very important for any weight loss journey. And that would be including, changing daily habits and behaviors targeted at the weight loss. So dietary changes, just kind of in a nutshell, would be adapting, different fruits and vegetables, whole grains, lean proteins, and healthy fats, reducing sugars and processed carbs and high fat, high sodium foods. And then, kind of focusing on protein control, portion control, and also just kind of going through like, okay, what have you eaten in the last 24 hours to kind of get an idea. I kind of I've kind of learned over time, really, like I kind of used to think that everyone knew how to eat healthy, and it's not the case. And each perception of what's healthy and what's not may be a little different. So and then some people, may not do as well with, gluten and, so we do try to customize it per patient. Some have dietary restrictions that make it hard. In physical activity, we want to encourage incorporating a daily regimen with walking, cycling, swimming, whatever it may be, to actually kind of get the heart rate up and find what you enjoy. And kind of as a general rule, and like from like different health organizations, they say to engage in at least 115 minutes of moderate intense exercise or 75 minutes of vigorous intense exercise each week. And this can be, have limitations due to injury and joints and inflammation. But for those who can, that is definitely recommended. And not to, forget also that exercise doesn't only help with our appearance and building muscle and burning fat, but it also helps with our mood. It elevates endorphins, and it strengthens our cardiac muscle so that we can be healthier and have lower blood pressure. So there are multiple effects of exercise just outside of our appearance. And we also are going to talk about setting realistic weight loss goals, kind of getting your goal, but then also, encouraging you along the way. We're going to be seeing you frequently, and we're going to weigh you and everything, but we're also going to talk about like, are your clothes fitting better? We understand that it's not always in a number, and we certainly don't want our patients weighing themselves every day and obsessing over something that they can't change quickly. So, but that is just kind of a number that we will go off of as well. And then just tracking the food and being more consistent with exercise. We do discuss sleep hygiene as well. So we kind of chuckled about this when we were practicing, because, you want to try to get adequate sleep, 7 to 9 hours per night for most adults. But I was joking, like, Christina, did you get 7 to 9 hours last night? Yeah, and I didn't either, but yeah, with 3 sick kids at home. So yeah, it's not always ideal. You're not always going to get that sleep that you need. But it definitely can help to, be a healthier individual with more successive weight loss if you can. And, decreasing distractions, shutting off those phones, and TVs, a significant time before bed, practicing relaxation techniques, proper hydration. So I always kind of go off the rule of like calculate like half your body weight in ounces is what you should drink daily. So that can be a lot. And some people exceed that. But it is just, it's hard to get it in. And like, I sometimes will go all day and I'll be like, I haven't even drank today. So it's almost like, like setting
Coffee
yourself up.
and not
Right.
anything else.
Yeah. And then, yeah, things that dehydrate you. And so, it's almost good, to carry around a water bottle so that you're reminded or like have it in your room with you, make sure it's with you, and make sure that you have a means to fill it up throughout the day.
And that could even be a goal as you're starting your weight loss, like just
Mhm.
making sure you're hydrated,
Yeah,
like you've got your water with you,
absolutely.
set a reminder on your phone. So getting in that recommended like 2 to 3 liters of water a day it's hard.
Yeah, absolutely. And it's definitely easier said than done.
So much easier said than done.
And then just stress management as well, engaging in activities that reduce your stress. I mean, I love yoga, but it's like just like getting there. Meditation, deep breathing, and then, managing stress through other like effective coping strategies. And then also maybe even just finding like areas of your life that are causing stressors that maybe you can cut out. Like, is there like a job that's just not serving you, that's like causing you more stress than anything, or a harmful or relationship, or just different things that you can kind of work on to help manage your stress is going to help you in a lot of areas.
So I can't cut my 3 kids off, so just
Yeah. Right. Unfortunately, some things you have
just
to,
have to
right.
just grin and
Yeah, I
bear.
don't want to like be causing all these divorces out there either, like Jen said. No, I'm just kidding. But yeah, where you can, I guess. And then just avoiding harmful habits, quitting smoking, or recreational drugs, watching excessive alcohol consumption. A lot of alcohol is very sugar, it has a lot of sugar in it. There's healthier options for alcohol, but I think look and see if you can limit that as well. Sometimes that can be a deterrent in someone's weight loss journey. And then just limiting or eliminating other behaviors that negatively impact your health.
Yeah, a lot to unpack there.
Mouthful.
Yes. So, as far as, when we talk about next level, so we talk about lifestyle modifications and all that we can do from a behavioral standpoint, lifestyle standpoint, we certainly can support also prescription medications and some other over-the-counter supplements. One of the medications that we wanted to highlight was phentermine. It is something that is it can be helpful in the short term. It's a controlled substance. We have to see you every month for that. It does require an EKG at the start of it. Phentermine is a stimulant, and so therefore it can kind of play around with your heart rate, play around with your heart rhythm. So at baseline, we want to make sure that there's a pretty benign cardiac history. And then we might routinely check an EKG throughout. But again, phentermine is kind of a short term. It loses its effectiveness after taking it for so long. So it's just not a great long-term solution, but coupled with all the lifestyle stuff, you might have a really good kickstart to the weight loss. And there certainly are other, prescription weight loss meds like Contrave that's out there, even Wellbutrin or bupropion. There are some other combination prescription ones that potentially insurance might cover that we can talk about if needed. The two biggest ones that are really popular right now that everybody is really familiar with is, the Ozempic and Zepbound. So we do the compounded versions of those. Those are the GLP ones. Semaglutide and tirzepatide, they work similarly. So the semaglutide, tirzepatide, so GLP, the glucagon like peptide, is a naturally occurring hormone in our body. So our body actually produces it, but its half-life, it only lasts for like 1 to 2 minutes. So they created these medications to last in our system longer. And so it wasn't getting broken down by this certain enzyme. And so both semaglutide and tirzepatide are GLPs, and tirzepatide, the cousin to semaglutide, actually is dual acting. So there's another peptide that it works on. It's called the GIP, which is the gastric inhibitory polypeptide. So GLP by nature, the whole goal of that is to improve insulin sensitivity, reduce blood sugar, and promote that feeling of fullness. And then the GIP part of it that tirzepatide has helps to stimulate that insulin secretion and influences our metabolism. So semaglutide is a single acting hormone peptide, tirzepatide's dual acting. So we have seen with tirzepatide, because of the combination of effects, that it can be more effective in weight loss. Some studies even say up to 22-23% of weight loss for that individual, and less side effects with the tirzepatide. So the whole mechanism of action of these medications is to slow down gastric motility. So food does end up staying in your system a little bit longer, so you feel full longer. Maybe your portion control is a little bit down. But with that, you can imagine that if your gastric motility is slowed down, there are side effects that can come with that. Nausea is a really, really big one. Nausea is a big one. Heartburn can be one because food's just kind of staying in there a little bit longer. Constipation is another really big one. For some people, interestingly, they actually have diarrhea. And I've noticed that the diarrhea is because if they eat something that doesn't bode well with the GLP, like if it's a high fat, like too greasy, their system does not like it. And it kind of flushes it out, if you will. So there are side effects that are associated with it. We compound the semaglutide and tirzepatide with B12, which is helpful for energy and metabolism, but it also helps minimize the nausea. And then there's glycine that's compounded in it, which is really nice because, you can imagine when you start losing weight really fast, we tend to lose our muscle first, which we don't want to lose our muscle. We want to preserve muscle. The glycine is an amino acid that actually helps to preserve our muscles so that we're losing fat more appropriately. So in a nutshell, that was the spiel on the GLP, semaglutide, tirzepatide. We'd love to talk more to you about it. And then there are some other supplements that are available over the counter. There's berberine, green tea extract, 7-keto lean gels, chromium. So these are some different supplements. I really like the berberine option because it kind of helps promote the regulation of blood sugar, and it increases metabolism of the fat breakdown. And there are certain enzymes that it helps kind of minimize fat accumulation, and it helps with appetite too. So
I've actually heard that described as nature's Ozempic.
Oh yeah.
Like the berberine. And then just to add to, we are seeing if when people are on the GLP-1s that they need to actually, if they're going to have a surgery, that they need to stop like 2 weeks to even up to a month before they just because of that slowed gastric motility, before a surgery and you're put to sleep, they have you not eat so that you don't have anything in your stomach that you can like throw up and aspirate. And so they were seeing that people still had contents in their stomach. And so now I think they probably just know that most people are on these meds and they ask everyone, but that was an issue in the beginning when they got really popular. And then as far as the side effects go, it's very much dose dependent. And so when people do have, not everyone even has a side effects at all. And then some people, like I've had this guy who like this big like guy that you think could handle anything, and he could not even handle the smallest baby dose. Like we couldn't even do the meds for him. It was crazy. So we do have you do your self-injection. We can also do the injections in the office weekly, which a lot of our patients do prefer. It's the same cost to them as they were if they were to buy it, but some people just don't like giving themselves a shot. And then we start at a certain dose and titrate up. And then if you kind of feel sick, you back down. So we just really control it. Sometimes, there are medications that we can give you like Zofran or other anti-nausea medications. We don't just hand you that prescription right off the bat. We'd like you to listen to your body and not get there. But that is a tool that we use sometimes as well. And actually the compound pharmacies have come up with other options other than injectables, such as sublingual drops. And so there is that option too for those that don't like needles. So, but we've had really great success. Like we've been prescribing them for going on 3 years now, I believe. And when we first started, I was very like cautious. I didn't want to do any harm to my patients. We both tried the medications ourselves. We have researched them a ton. And ultimately, there can be complications for sure. And that's why we look at everything. But most of our patients do very well and have seen great results, and it's been amazing.
Well, and it has such a safety profile, and now they're seeing there's a lot more internal therapeutic benefit with it
Right.
too, like improving cardiovascular health by helping like lowering your blood pressure, lowering your
Mm-hmm.
blood sugars, which then lowers your cholesterol. And I know a lot of people even say like it's helping my inflammation. Like
Yes.
I feel like I have total body inflammation. I feel so great on these.
Mm-hmm.
Like I
Yeah.
never want to get off of it. So there's a lot of
Mm-hmm.
other benefits that are coming out with these. And, like to Jen's point, it's not a one size fits all. These medications, one may work well, one may not work well. So we just have to kind of figure out what works for you, and go from there.
Right. And they're also finding that I think they're doing a lot of research in these meds too for like cancer and like
Yeah.
neurological conditions. It's been
Dementia
recently
even.
FDA approved for with the pharmaceutical ones for sleep apnea,
Mhm.
dementia. So it's actually really exciting. And really these medications have been out around for a really
Oh,
long time. Like they're diabetic medications to start, but there have been other forms of them like Saxenda and like other injectables already out there. So they're not new. Like I think for a lot of people they think they're new because
mhm. The
everyone
hype around it.
the
Yeah.
hype around them. But that did stem from, these pharmaceutical companies getting FDA clearance for weight loss. And so, but it's been really a great thing. So
All right. So next up, we're so excited to introduce, we're now the proud owners of an InBody 580 machine.
Christina's been bugging me
Woo!
forever to get one of these, and I'm like, fine.
So pumped about it. So this is the ultimate body composition analysis machine. Yes, it looks like a glorified scale, but it is so much more
It's like
than
a
that.
robot,
I
actually.
know it does talk to you.
Oh,
Yeah.
no.
And it's really smart. It does a lot of things. So one of the things it looks at is your body fat percentage. So it measures the amount of body fat you have compared to like your total body weight. So obviously we know weight is just a number, but it's going to
Mhm.
break down what is that weight actually composed of. So it measures your muscle mass, your lean body mass, which includes, organs and bones and other minerals and organ and your skin and all that stuff. It will measure water content. Are you hydrated? Are you dehydrated? Is there inflammation going on? It'll measure visceral fat. And visceral fat is so key because this is the fat that surrounds and wraps our internal organs. And it really is, if you have a high visceral fat, it's a really important indicator that there could be future health risks for you, like diabetes and heart disease. So we can help identify where's your visceral fat at and what can we do to lower that number and lower your risk. It will also calculate your basal metabolic rate. So this is the number of calories that your body needs to do its normal function. You could just sit at home, rest, breathe, blink,
Mhm.
swallow, digest your normal food. And it's just the number that your body needs in order to do its daily function. And certainly that'll change. That number will change depending on your activity level and your goals for exercise. The segmental analysis, really cool because it breaks down the 5 different areas. So your trunk, which is front and back, your arms, your legs, and it'll actually show you your muscle, how much muscle you have in there, and if there are any imbalances, and is your frame and your muscle distribution appropriate? And do we need to identify if there's any risk for injury because there's an imbalance there? Is your right arm stronger than your left arm? So it's really neat at being able to identify all those key pieces. It does include a body mass index, which I feel like the BMI is an evil number because it's literally just your height and weight. But what it does is it shows you when it's talking about the obesity analysis, it also brings in the body fat mass or the percent body fat, which is way more appropriate for determining health risk
Mhm.
than just a BMI. So it'll actually break down the percent body fat. So what I'd like to do is show you an example of the results sheet. So here up at the top, so when you come in and do your InBody, you're going to put in your ID, which is going to be your phone number. And each time you plug in your phone number, it's
Mhm.
going to pull over your previous results so that you can track and trend over time. And down here at the bottom, you can kind of see that composition history. So you can see where you were and how you're going and where you are.
Mhm.
And then up here in the top, this is the proof that you're more than just this number on the scale. You're comprised of water, that dry lean mass, and then the body fat mass, and all those numbers added together is your total weight. In the muscle of fat analysis section here, we will talk about what the ideal kind of body structure is. So we'll kind of identify where you're at and what we're looking for. And there's that obesity analysis. So this is interesting. So this BMI you can see is in the normal. So this is under optimal, optimal, and then above optimal. And this person in particular for this example is like in a normal, high normal BMI range, but you can see their percent body fat is actually really high. So that's kind of, I'm sure people have heard of like skinny fat. I don't love that term, but it is what it is.
Yeah.
So they look lean, but they're inappropriately lean. They don't have enough muscle. They're actually comprised more of fat. So interesting. And it goes the same for a bodybuilder. A bodybuilder may be in a high BMI because it doesn't know what it's comprised of and puts them in the category of being obese, but the percent body fat could be really minimal. So that's why the BMI is evil. I'm not a fan.
Yeah.
And then here's that segmental lean analysis where it breaks down each body part to tell us how many pounds of muscle are there. And then this bottom bar represents is that area strong enough to support your overall frame? And then here's that water component. This person in particular has a little bit too much. That could be related to inflammation, actually be dehydration, or something acute going on there. And there's that visceral fat number there. We'll like once we do your interpretation, we'll go over the rest of the results. But you can see there's a lot that goes into it. Really helpful knowledge because as you are on your weight loss journey and you're trying to lose weight, we can actually track and trend that in your skeletal muscle mass movement. This bar would move, and then all of these areas too will be and going in the right direction. And then if not, then obviously we would adjust your plan.
Very comprehensive.
Woo!
Yeah, it's so exciting. Yeah, she's like obsessed with this.
I know. I just think it's so objective and it really helps you identify like a good plan.
Yeah, it's nice because like sometimes when we would have people come in every month, they're, for their weight loss stuff, we're like, okay, like, are you losing weight? Are you close fitting better? They're like, oh, I don't want to get on the scale. I got on this morning, or I want to do it in the morning. I'm having my shoes on, blah, blah, blah. So we're taking your word for it, but it's like, which is fine, but like it's not that great. And then also sometimes maybe you have some water weight that day, or maybe you are gaining more muscle because you're starting to work out more. And so it's just like nice to have like a fact, like like some data to like go off of. So I love it. And then we're also very excited to introduce another device that we brought on this past year called the True Body by Hutera. So the True Body is two devices, the True Sculpt and the True Flex. And so the True Sculpt is actually a low frequency device that penetrates the sub-Q fat layer. It uses non-invasive monopolar radiofrequency heat technology to destroy and melt and permanently remove fat cells through the process of apoptosis, like cell death. And so this picture is nice to kind of depict how, the heat goes down into the sub-Q fat layer. And over time, it's going to, we adjust the temperature for your comfort, but we do push it because we need to reach a certain temperature to cause apoptosis. So once we've reached that temperature, then it has to kind of stay there for a little while, but it's constantly like rotating through different paddles. So it's very tolerable. Those damaged fat cells are broken down and eliminated through the lymphatic system over 12 weeks. So it actually takes 12 weeks to see results, but a lot of the times we can, most of our patients are just doing one treatment. And then we're waiting 12 weeks, we're reassessing, we're getting after photos. And now that we have this scale, we're doing the scale. So like ideally we're going to see fat reduction, fat loss. And you can start to see results as soon as 6 to 8 weeks as well. And so but over that 12 weeks, this fat is being broke down. You're actually eliminating it through your lymphatic system. And we're seeing up to a 24% reduction in fat with a single session. Sometimes we will recommend a second session. It depends on how much fat you have and what the results were. But this is really exciting. It's really nice to pair with the other weight loss options, especially for that stubborn visceral fat or the fat that's more at the surface, so sometimes even when we have been doing the GLP-1, someone's on hormones, they still have this little pouch that they're frustrated with. And so this is kind of our option for that. And so we have seen really good results with this. And so if you can just, these are some great before and afters that are from Qterra. They're from the studies that they did after one True Sculpt treatment. So you can see, and we have several patches with each treatment, so we can really target like a full abdomen, a full back, and whatever area you would like to focus on. We just have to make sure there is enough fat there. So we literally are measuring the fat, and you have to have a certain amount. We have had some patients that were like searching for fat on, and we're like, again, like, okay, like, what are you doing? But fat can be very stubborn, and most of us have just a stubborn little area that's, but we're not going to treat it if there's not enough fat there. That's wouldn't be safe. So exactly. But for the most part, most of our, it's not a problem. And then this is another really nice photo here, showing that fat reduction after one treatment. So it's pretty exciting. And then the True Flex is using multi-stimulation, muscle stimulation that targets muscle contouring. It's basically a bunch of patches applied, and then they're communicating with each other. So we're like twisting, we're pulling, we're doing different muscle contractions with each treatment. And so we're actually kind of creating like up to 45,000 crunches in 15 minutes if we're doing your abdomen, or 10,000 squats if we're doing your legs and your glutes. It's pretty crazy. And it's very customizable to the patient. So like we turn it up based on their tolerability. And some people we're like, oh my gosh, it's crazy how high we can go. Other people, not as much. Or we might start them off lower if they're not used to working out, or they've had not recent abdominal surgery, because we do wait a certain amount after an abdominal surgery. But if they haven't been using their muscles, it does require a series of sessions, as you can imagine, because we're building muscle. So it takes a little time. But we do have packages where you're actually doing 6 sessions, and we're doing them pretty frequently. Like we don't want to wait longer than 5 days between each one of those. So we're doing them within like 2 to 3 weeks. And then we do recommend a maintenance program after that, because you built this muscle, and then we want, you're going to want to maintain it, I would assume. So monthly, we sell packages for monthly or quarterly sessions. And then the people that are already working out, it's just going to elevate that. And then, we're looking at the measurements through the InBody as well to see our improvement on muscle. So it's absolutely. So, and we do have a patient who has an InBody scale. She's a fitness coach, and she has been doing her InBody, and she is seeing results with the Flex. She's just doing the Flex. Yeah. So it's really cool. And then, it's kind of funny too, because especially when we do the abdomen, it's like, it makes people giggle. And so,
uncontrollably too.
Yeah. So all of us have done it, and it's been just kind of cute. Like we'll just be in there just dying laughing. And we have a patient who, like, you literally can hear her snort like from across the office. And it just, I don't know, it just makes my day. It's like, who doesn't need a good laugh? Right. So that's just a side benefit. But but who couldn't use more muscle? It's a great thing. And the two devices are great paired together because on one end we can do them right back to back. So
Mhm.
like we're destroying that fat with the heat, and then we're right away just like toning the muscle. So like that fat's getting destroyed, we're building muscle. They work together. And another thing that I like to tell people that I really resonated with me is that this muscle stimulation actually improves and increases your own metabolic rate. So it actually makes you burn fat better and makes you more fit. So like all the benefits of a muscle and but minus the lactic acid buildup that you would get
Mhm.
if like when we work out really hard, when we have it for a while and we're really sore, you're not getting that. So you can be sore though.
Yeah,
No,
okay,
yeah,
yeah.
you definitely can be sore. But it's
No
nothing
health
like
risk with it for sure.
exactly right of rhabdo or whatnot.
Mhm.
And then you may see results within 2 to 4 weeks, your full results within 4 to 6 weeks. So super exciting.
And there are some potential contraindications
Yes.
that we just wanted to touch on. Certainly, we won't do it if you're pregnant, if there's a pacemaker, defibrillator, if there's a history of any metal implants in the body, seizure disorders.
Mhm.
Certainly, there are other conditions, and we'll screen you for those prior to treatment just to make sure that you're fully appropriate.
Yeah, there may be some caveats with some of those, but yeah,
Mhm.
there are definitely with anything, there definitely are some contraindications. And then these are some great photos of the True Flex from Cutera after 6 treatments. We're still developing our portfolio, so stay tuned, but
Yep.
we are seeing really great results and I'm hearing great feedback from patients. This guy's got a good 6 pack here. And this was just after 4 True Flex.
Yeah, like I feel like he was really good to start, and then it's just
Yeah,
like, woo, he
yeah,
just like popped it out
exactly.
even more. And
Yeah.
not all people might respond that way, but
Right. We're very careful to promise results. Like everyone is different and it's always going to depend on several factors too, like your own commitment to, coming in for the procedures, what's your diet, like with anything, there's a lot of factors, but this is such a great device. We're really excited
and
about
that's a
it.
good point because it's not like you can do just this. You have to really combine it with it's in conjunction
Mhm.
with the lifestyle and
Yeah, like if
every
you're going home and drinking like a
defeats the
bottle of
purpose.
wine every night, yeah, I don't know if I can,
You calling me out? Just kidding.
Oh gosh. Yeah, little wine for Christina.
I need it. Just kidding.
So
I'm gonna open up our chat too just to
yes, I think
see.
there was one question there. Oh, hi Elizabeth. Sign Joe up, huh? Love it. Yeah, we would love Joe in here. I would love to hear him giggle when we put the yeah. So a lot of people ask, will I ever be able to stop treatment? And absolutely, like any of these treatments can be tried and stopped at any time. It's just that a lot of times once you have been doing treatment and you see results, you want to continue them. Just like anything, I think, when I trained for a marathon like 10 years ago, I was like the skinniest I've ever been, and I stopped training for a marathon. And, so
Yeah.
it's just like, it's like you want to continue it because you're doing well on it. And we're always just make sure that that's safe for you. A lot of the times when we see, for example, if someone's on the GLP ones and they're expensive, like
Yes.
the compounded options have made it very affordable for people, but they're still expensive. And we get that, trust me.
Mhm.
And we want the most value for your dollar, and we want you on it as least time as possible as well. But some people have felt that they've had to kind of go a little bit longer. Maybe they stretch out their injections, or they go with a lower dose. It just kind of keeps them good for a
Makes
little while. Yeah. And then they can get off, assuming they're, kind of changing habits and they're doing really well. I do have some patients that have been on it for a couple of years on the maintenance, and it's helping with their inflammation and everything else. And we're still seeing them. We do see our weight management patients sometimes every month, a lot of the times every 2 to 3 months, and we're checking you as you go because we want to make sure there are no contraindications and that we're keeping you healthy, or if we aren't already looking at hormones or something else that we are. And then people ask, will the weight come back after stopping? And yeah, like probably, like I mean, if you don't do what you need to do, like it's so of all the all the things out there with all the the slogans like Ozempic face, Ozempic butt. What are some of the other ones? Like there's just all these different like snappy and people are like, I don't want Ozempic face. Like, well, any weight loss is gonna cause loss of fat in our face. Like our bodies, like unfortunately don't know like when we lose weight, like where they should hang on to it and where they should lose it. And so, and we actually want fat in our faces. I mean, Christina and I are injecting, collagen stimulators and fillers in people's faces that have volume loss all the time. And so, on one end, I want to tell you, like, if that happens to you, we have you, we have your back. But at the same time, like, that is just part of weight loss. And unfortunately, and we are talking to people when they first start to about their diet habits and also telling people like it's a good idea, like when you are feeling less hungry to go ahead and like make a journal or log like what are the things that I do? Like, do I come home at night and do like late night snacking? Like, do I when I'm shopping at the grocery store, what am I buying that I shouldn't? Like just doing some of those habits to kind of create like get yourself out of these habits because that's a big thing.
And I was going to say there's also the flip side of it too, because they're suppressing your appetite so much that actually also for some people is driving down their desire to drink, even like drink water.
Right.
And even, they're like, I just am skipping meals altogether. And it's like, well, that's not a good thing either, because that's like depriving your body. And then your body thinks it's in starvation mode. So then you're like holding on to everything. So it's also really important with these particular medications to make sure you're staying adequately hydrated and you're getting a good amount of protein in as well.
Yes.
In order for those medications to work appropriately.
Yes, absolutely. And then a lot of people ask too, we get this question a lot, is like if they could use insurance. And if you do feel like you would meet the criteria for your insurance to cover, I mean, it is pretty stringent. Like there is a certain BMI and also like typically like a diagnosis of diabetes or which you would never want someone to put on your thing unless you actually had diabetes. And some insurances may be better than others, but to be honest, like we have not seen the greatest with insurance coverage. And I can only imagine that maybe as they've been paying out more for this med that's very expensive, they're trying to find ways to not have to cover it. Otherwise, our premiums are all going to go up. So unfortunately, it's not something that's typically been covered. But if you do meet that criteria, we do encourage you to ask your primary to actually prescribe those, but we are mainly just using the compounded options. We do have a couple of patients who do still like to get the pharmaceutical option. They're paying out of pocket because they work better for them, and we can certainly prescribe those. But I think bottom line is if you have questions, just let us know because your situation may be different and we're willing to work with you. So.
For sure. Great. So
any more questions? Like that was a mouthful. You guys are probably all sleeping.
okay.
Gosh, we just get so excited about it though. Yeah. So again, thank you all for joining. You can scan, unless you're on your phone, of course, this QR code for our is that our link tree or just for all of our links. There's our contact information.